Hi, I'm Dr. Gregory Lieberman, a sports medicine and joint reconstruction specialist with the Orlin Cohen Orthopedic Group. I want to discuss some basic information regarding knee pain that I see every day in my clinical practice. Although we are surgeons here, we all try to treat our patients with the safest and most reliable and cutting-edge technologies that are available. The option of surgery comes into play once other treatment modalities have failed. Before discussing what is the cause of a patient's knee pain, it is important to have some basic idea of the structure or anatomy of your knee. The knee joint is composed of 4 bones: the large thigh bone or femur, the shin bone or tibia, the kneecap or patella, and the outer shin bone, the fibula. There are 4 ligaments which are joint stabilizers: the crossing ligaments, the anterior cruciate ligament, ACL, the posterior cruciate ligament, PCL, and the side ligaments, the medial collateral ligament, MCL or inside, and the lateral collateral ligament, LCL, outside. These structures connect bone to bone. There are muscles and tendons about the knee that help move the joint and make us move. The main 2 are the quadriceps muscle in front and the hamstrings muscle in the back. Within the joint are 2 types of cartilage: the joint surface or coating or articular cartilage. These coverings are smooth and almost friction-free. There are also the cushions in between the bones, the meniscus, intermedial and outer lateral. Then there is the joint lining or balloon that covers the joint, the synovium. This helps lubricate and nourish the joint. The most common condition that I see which causes a patient to have knee pain is osteoarthritis or OA. Half the population, 50 and over, and nearly everyone older than 75 will develop OA. Other common conditions causing knee pain are bursitis, inflammation of coverings over bones or tendons, tendinitis, inflammation of the tendon themselves, sprains or strains, which are injuries to the ligaments and the tendons, cartilage or meniscus tears, fractures of the bones, and rheumatoid arthritis. Symptoms of these conditions include pain, swelling, feeling of giving way or buckling, decreased motion of the joint, heat from the skin over the joint, decreased ability to walk and especially go up or down stairs, sensation of joint rubbing or grinding or the joint creaks, stiffness and difficulty when starting to get going after rest or periods of inactivity. OA involves the loss of the joint lining, articular cartilage, and decreased ability of the joint to lubricate itself. This condition affects the knee in over 20 million people in the U.S. Treatments based on managing the pain and improving the patient's symptoms. This might include RICE, which stands for rest, ice, compression, and elevation. Activity modification, a range of oral medications or cortisone or viscose supplementation injections. When all else fails and the pain is uncontrolled and the patient's everyday functions are affected, then surgery must be considered. Arthroscopic surgery typically offers good results. When necessary, total or partial joint replacement can be utilized. In our group, we use state-of-the-art techniques including minimally invasive surgery, computer-assisted surgery, and partial joint replacement where appropriate. We supplement our surgeries with pain management techniques to diminish pain that might exist following surgery. We perform bloodless surgery using cell saver and blood spinning techniques to augment our surgical procedures and to make these procedures safer for our patients. For more information about knee pain or injuries, please visit the patient education section of our website, orlincohen.com. For an appointment to see me about your knee or any sports medicine injury, or to see any of our highly qualified subspecialists, please call our office or visit us online.